The Lady with the Lamp, the story of Florence Nightingale. In the early 19th century, a time when women were expected to marry and manage households, a young girl named Florence Nightingale was born into an upper-class British family in 1820. From the beginning, Florence was different. While her peers learned embroidery and piano, Florence devoured books on science, mathematics, and philosophy. She was bright, independent, and driven by a deep sense of purpose. At the age of 17, Florence claimed to have received a call from God. But it wasn't to preach or become a nun, it was a call to serve others. She believed her mission in life was to care for the sick and suffering. When she told her parents she wanted to become a nurse, they were appalled. At the time, nursing was not a respected profession. It was associated with poverty and vice, not something a respectable young woman would pursue. Her mother cried. Her father was furious. But Florence was determined. She secretly studied nursing at the Institution of Protestant Deaconesses in Kaiserswerth, Germany. She spent her days cleaning wounds, comforting patients, and learning the fundamentals of hygiene and hospital management. When she returned to England, she took a position at a small hospital in London, where she immediately began reforming its management, improving sanitation, and reducing death rates. Then came the Crimean War in 1853. British soldiers were dying in alarming numbers, not just from battle wounds, but from diseases like typhoid, cholera, and dysentery. The conditions in military hospitals were horrifying: dirty linens, poor ventilation, and overflowing sewage. The British government, desperate for a solution, asked Florence to take charge. She arrived at the Scutari Barracks Hospital in Turkey with a team of 38 nurses. What she found shocked her. Wounded soldiers lay on bare floors, rats ran across the wards, and there was no proper water supply. Florence didn't panic. She rolled up her sleeves and got to work. She ordered scrubbing brushes and cleaned every inch of the hospital. She set up kitchens, laundry services, and even a classroom for soldiers. Florence believed in data. She meticulously recorded death rates and causes, using statistics and pie charts to show the impact of sanitation. In just 6 months, the mortality rate dropped from 42% to 2%. Every night, she walked through the corridors with a lantern, checking on patients, speaking to them softly, comforting them with her presence. Soldiers began calling her the Lady with the Lamp, a symbol of hope in their darkest hours. When she returned to England, she was a national hero. But Florence didn't care about fame. She used her influence to push for healthcare reform. She wrote over 200 reports, including her famous Notes on Nursing, which became a standard textbook. She convinced the British Army to improve its hospitals and the government to invest in sanitation, both at home and in colonies. Despite suffering from chronic illness for much of her life, possibly due to a bacterial infection she contracted during the war, Florence never stopped working. From her bedroom, she advised governments, mentored nurses, and led the fight for public health reform. Florence Nightingale died in 1910 at the age of 90. She never married, never had children, but she changed the world. Today, hospitals around the globe follow the principles she fought for: cleanliness, compassion, and evidence-based care. In an era that tried to silence her, she became a voice for the voiceless. Not through noise, but through quiet, determined service.